Good evening, Professor. Today I'm going to talk about my seminar with the title named The Heterogeneity Among Individuals with Overgrowth and Obesity by Social Demographic and Lifestyle Factors. First is the introduction. According to the World Health Organization, the overweight and obesity are defined as abnormal or excessive fat accumulation that present a risk to the health. And the body mass index is a measure of the height and weight, which was defined. The overweight range from 25 to 29.9, and the obese have the body mass index more than 30 kilograms over meter square. And in 2013, the American Medical Association reported that obesity was classified as a disease. There are several causes of overweight and obesity, which was the bad habits, community environment, genetic, and disease drugs. And there are some diseases which were the consequence of overweight and obesity too, which were the heart disease, diabetes, kidney disease, fatty liver, cancer, and high blood pressure, which are the cause of death. In 2017, the Global Burden of Disease report that 4.72 million people was dead by obesity, which ranked the first of the total disease. Many evidence suggest that many individuals do not meet the recommendation from health providers with multiple obesity risk behavior occurring together, and as we can see, the proportion of overweight and obesity continued to increase non-stop from 1975 to 2016 over the all continents. As we know, the body mass however, a conceptualization of individuals with obesity as defined solely by BMI may not reflect the true heterogeneity encountered in clinical practice. So the clustering the clustering of individuals with similar characteristics is a concept that has been applied to understanding the association among the different health behaviors. The objective of this seminar is to investigate how individuals with overweight and obesity differ from social, demographic, and lifestyle factors. The paper one named Clustering of Social, Demographic, and Lifestyle Factors Among Adults with Excess Weight in Multilingual Countries, with the objective to identify and cluster potential social, demographic, and lifestyle determinant of excess weight in Switzerland. The methods is a cross-sectional Michigan survey from 2014 to 2015. The total sample size was 2,057 people who are aged from 18 to 75 years old and completed both 24 health dietary records. An important thing of this research is that the definition of excess weight is people with the body mass index more than 25 kilograms over a meter square. And this research analyzed about the social demographic anthropometric measurement, 24-hour dietary records, and the Internet Healthy Eating Index, and the physical activity through the IPAQ short form. The statistical analysis of this research include the descriptive statistics, multivariate imputation by chain regression, the sample weight, multi-dimensional logistic regression, cluster analysis, and all of this was analyzed by R version with a p-value less than 0.05. The results. In the table 1, we can see that the proportion of men and women in this research was equal, were quite equal, and most of the people have in the middle age, and most of them, most of the language was German and French, and also we can see that quite quite how the people graduate from secondary school and more, and 39.8% of the people have the middle income. The table 1, beside for the household status and marital status, we can see that most of the people was in a couple and have marriage. The table 2 shows the results of the sex-stratified multi-dimensional logistic regression analysis. Through the end, you can see that the higher age will increase the risk of overweight, obesity, and exacerbate in the both sex, and the poor education in women will increase the risk of overweight, obesity, and excess weight too. And in both sex, the lower income, the individual have the income lower than 6,000 will have the risk of overweight and obesity more than the people have the income more than 13,000. And besides, for the individual with poor health status in both sex will increase the risk of overweight and obesity, and also excess weight. But in a contrast trend with the AHEI score, the lower AHEI score will have the risk of overweight and obesity and excess weight more in both sexes. The figure 1 shows us we can see that for the age, the proportion of overweight and obesity associated with the increasing age, which will contrast with the energy index and AHEI score. The lower energy intake and lower AHEI score associated with the higher proportion of overweight and obesity. The figure 2 shows the social demographic and lifestyle pattern among excess weight cluster in Switzerland. And we can see that the research classified the four pattern, which was equal with the four column here, and uh, and the red cell in this figure represents for over present, and the blue cell means that's under present. And let's focus on the first column. You can see that the adult living with parents had the value was 14.3, and the highest had the value was negative 14.6, which by the two things, the name of this cluster was young living with parents. And also with the second column, we can see that 17.3 was the value in the main cells, and 15.1 was the value in the tertiary education. And by the two things, the name of this cluster was men with high educational level. And the same examination will be applied for the cluster 3 and 4, which were women living alone and low educational level in Italian speaking region. Discussion. This research showed that higher age, poor cell-related health, lower energy intake, lower AHI score was the strongly risks associated with the excess weight. They found the four patterns in the excess weight group, which were young living with parents, men with high educational level, women living alone, and low educational level in Italian language region. There are some limitations of this research, for it is a cross-sectional study and therefore costly could not be assessed. And most considered factors were self-reported and thus were assessed on 2 days. And the body mass index may misclassify in some cases, such as the people with high muscle mass. For the conclusion, our finding emphasized the importance of considering people with excess weight as a heterogeneous group. The paper 2 has the title name A Demographic, Clinical and Behavioral Typology of Obesity in the United States, with the objective to discover and develop an understanding of the type the adult individual classified as obese according to demographic, clinical, and behavioral factors. Now we will move to the methods of this research. It is a cross-sectional study from 2011 to 2012, and they use a stratified multi-stage sampling design to produce data representative of the US prevalence. And the original sample size was 9,756 people. Then they chose 21.3% of the original sample who have the BMI more than 30. In the third step, they chose 90% of people who have the age more than 20 years old. And finally, the sample size was 1,380 people who were obese and older than 20 years of age have complete the data. The data analysis research was focused on the demographic indicators, behavioral factors, chronic conditions, and the depression was assessed by the patient health questionnaire, physical activity was assessed by the Global Physical Activity Questionnaire, and the dietary assessment was assessed by the Healthy Eating Index. The statistical analysis of this research includes the sample weight, cluster analysis, BAC, and the continuous variable was standardized using Z-score, ANOVA, and cheese test, and all of this was assessed by the SPSS with a p-value less than 0.05. Now we move to the results. The table 1 shows that, as we can see, this column shows about the characteristic of the obesity group, with the sample size was 560,928 people after weighting, and the mean age of this group were 48.3 years old. The most rate of these groups were non-Hispanic white, and they most of the people have the higher middle-aged income. Besides, 35.8 was the mean body mass index of this group. And we can see that for the health problem, dyslipidemia and hypertension were the most popular health problem of the obesity people in this population, and the mean dispersion score of this group was 3.5, which was no depression. The table 2 shows that this research classifies 6 clusters of the obesity group, which were the affluent men with sleep disorder, elderly smoker with CVD, older women, poor mental health, healthy white women, healthy non-white women, active men who drink higher amount of alcohol. And we can see that the red color in this, the red color mean lower than the mean of population, and the green color mean lower than the mean of population. Now let's focus on each cluster. First is the older woman, poor mental health. You can see that the mean body mass index of this cluster was the highest compared with other cluster. Yeah. Next is the healthy non-white woman. They can see that the cluster is characterized by a good cardiovascular disease and respiratory health, with the green in the cells. For the cluster named active men who drink higher amount of alcohol, most of them was Mexican Americans and have low prevalence of all health conditions. Besides, they have low mean BMI. It's clear. And for the cluster affluent men with sleep disorder, we can see that most of the people in this research have a low level of anxiety and depression. Also, they have the second lowest score for physical activity here. and about 2/3 of individuals smoking. Just here. For the cluster early smoker with CBD, um, the mean of HEI in this cluster was the second lowest, which means that they eat unhealthy. For the healthy white woman, most of the people in this cluster have the healthy behavior uh, based on the based on that they have 0% of the people smoke more than 100 cigarettes, and they have the highest number of people non the drinker. And also um, the healthy eating index of them was the highest. The discussion. Uh, this research was this research compared the results with other research of Green MI in 2015, and we can see that research classify the ability as sick group 2, and there are some cluster have the similar meaning with uh, with uh, the present research, which were early individuals who smoke with CBD had the same meaning with poor health. Older women with poor mental health was equal with unhappy and middle age. Healthy white women, healthy non-white women have the same meaning with younger, healthy females. And active men who drink higher amount of alcohol have the same meaning with heavy drinking males. There are some limitations of this research. First, the final discussion of the number of clusters identified can often be subjective, and the lack of longitudinal data and do not have information on medication. Um, the conclusion, this study indicates that there was significant heterogeneity among adults with obesity in the US according to the demographic, clinical, and behavioral factors. To summarize, when compare the two papers together, you can see that the paper 1 shows the 4 clusters in the people with excess weight, and the paper 2 shows 6 clusters with 6 clusters associated with the with the obesity group, and the meaning of the cluster in the two papers have no similar. Together, it's mainly because um, each research have the uh, have the own region, which is the paper 1 in Switzerland and the paper 2 in the USA, and the characteristic finding of the two papers have different. The paper 1 focus on the behavior and the social demographic, while the paper 2 focus on uh, the two characteristic and clinical characteristic too, which was um, which was effects on the results. And by this way, a better understanding of the heterogeneity of individuals with obesity may help public health practitioners, researchers, and policymakers to establish titles, and appropriate goal for obesity treatment and better design intervention and clinical trial around prevention and treatment. So this is my presentation. Thank you for listening.